І так, як і обіцяли, включили Ірину Юрівну.
And Iryna Yuryevna now online. So for a certain time period to take your questions, please let us start off with the question that was in the first Bitsko Ivan Vasilievich. Will you have the HSU Kateryna monitoring delivery service package available? Can you hear me well? We can hear you excellent. So highly esteemed Mr. Ivan, we won't have a separate Kateryna monitoring package, and it shall not happen because it is a comprehensive service and it is integral to neonatal care service, and it is provided in the outpatient setting. That is why, so we have an opportunity to speak about this service and to have it well described and stipulated in the confines of the outpatient setting, and the NHSU will try to make it happen this year. So having support from your partnership, Anastasia, do you have a relevant regulation as of now to help Kateryna unit works and proceedings? So if you're talking about the national level documentation, from the very beginning I said we don't have it, but we have listened already, so high level of the European experts, and for our understanding, it seems to us, it is our national peculiarity that in each problem we are trying to come up with our own wheel reinvention rather than being able to introduce in 2018 the standards of neonatal care service delivery. So I'm keeping my fingers crossed. So as someone of the expert medium, so of the European Union will bring up this agenda, so in front of the European so medical community as a stepping stone towards European Union accession and introduction of the standards, we can implement it and take the least expensive Kateryna monitoring, and no one is interfering you within the setting of the health facility or regional setting to introduce the system and to have local guidelines and regional guidance and regulations to make it all happen. So we had yet another question to ask here that has been voiced again, and it's been asked here. Phenobarbital midazolam, and so we don't have it in the guideline, so we don't have the guideline. So to manage so neonate convulsive syndrome for Kateryna monitoring, it is important. Yes, I would like to support. Yes, I don't have the question to the answer to the question when, because not myself personally, nor the NHSU isn't here. Yes, of course, the guidelines should be compiled, or you should take the standards as a baseline that exists already, and to have a regional, local, or national guideline for that matter, and every one of us is interested in it. So until we have this guideline, none of the vendors or distributors or manufacturers will be able to enter the market. Would you like to ask some more questions as we move along? And Kateryna, so there was, so what is the duration of Kateryna monitoring? And so in the previous regulations, in relation to the range of perinatal tier, three-tier care service delivery, so up to 2 years, as a rehabilitation package of the preterm born babies is about the 3 years, and some standards, and let alone this regulations, the health ministerial regulation that provides rationing and provisions towards the assessment of the risk of children's development disorders until 4 years of age, and it must well be a decision put into a professional community. So for how many years we should put into the Kateryna monitoring duration? Larissa Sitch, where should we put data in about the children who are under monitoring in the Kateryna units, in the paper-based or into the electronic system, into the electronic means of medical information system if you want to get money in return for outpatient service delivery. But it shouldn't be done by neonatologists. It must be done by a different medical professional. Please pay attention here. And Volman Tatiana. So what are the eligibility criteria? So check performance of the deterministic units. So when we will have at least one regulation in place to secure those provisions, then the NHSU will be able to get on with your communication. What is the eligibility criteria to check it? So far, it's been really the check of the documents to say is that it is really we have such and such units in the health facility. We have the certain specialists working pursuant to the regulation and appropriate case management of primary healthcare records and its entry into the e-health. Olena Olinik, who should refer children into catamnestic so monitoring after discharge from hospital. It is too late after discharge. You as a neonatologist must refer children. So during referral, and it must be reflected upon in the discharge leave. And if you have the catamistic units fully operational in the health facility, or the pediatrician or physical therapist, occupational therapist must so check up the child. So in the last days prior to discharge, so to identify Silka has been talking about. So it is the medical history, the file, and allow the mother of the child a clear pathway where that particular child should get in the cataministic monitoring pathway. And some health facilities and clinicians even let alone the date of the first cataministic unit visit. Okay, let me find out if more questions coming in. So, colleagues, would you like to ask more questions, perhaps as we move along, and whilst we are deep in thought about the questions? So, whenever Asta has said that children do not belong to the hospital made by day to day. So, dear colleagues, I would like to pay attention. So the children not belong to the hospitals, don't belong to the hospitals, but they belong to the families. And we have the next speaker to bring up, and then Mrs. Iryna will be asked to once again come round and close out this event. Perhaps she will take the questions. And once again, I would like to remind to you this is the event of the catanistic management of children in the PMG framework. And this event is held together so with the Health Ministry and the UNICEF and NHSU, so with the support of Early Birds and Medical Nurses Association. And our next speaker, one of the initiators of this event, Oleksandra Balyasna, who is uh, on us executive official of this Association of Early Birds. Thanks very much, dear colleagues. So for the privilege to make presentation in this, so to come and share, so in the implementation of the cataministic monitoring of the children. So and we resort to the hallmark of this event. So communications. And a few more words, I will tell you why I have this opportunity to speak about you, and I'm a preterm baby mother. So 11 years ago, and my daughter was born in the perinatal center in Kiev. So 28th gestation week, and she is now 11, 1,270 grams body weight at birth. And we had our own catamistic, but it's more related to our own ways how to get through to our own system. We didn't have a system-based approach at that time, so that is why every day when talking to the other parents, so we get to understanding how it is very painstaking issue and a lot of money, efforts, time used, and it is very precious time in the very first months, in the very first days, when all of the children's development functionality is crucial. So if you don't join in now, so it will impair the health of all the other ones. And I will speak about the. So we were So here in Kiev, established in 2016, and we now cover the whole of the Ukraine, and we are trying to do the networking with all the main stakeholders, and we have the membership in the EFCNI, and Silke Mada was representing, and I am member of the advisory group of the EFCNI, so from 2019, and our team, not all of them represented in this photo, but our key team, 10 people, and our volunteers out in the regions, and we have also the Watchdog Committee. And briefly, so to highlight our mission, just for you to understand, to be able to understand, so to promote each preterm born baby and their family should get the highest level of medical, psychological, social support for implementation of their rights and empowerment. And this is what we do about it, and our activities also focus on advocacy, so to impact upon policy making, training of parents and those who collaborate with them, informational awareness, psychological, social support with the preterm babies and catechistic. So this slide here now about the parental perspective and about the introduction of care, especially this time. And I think that any one of you, so because you can see the, so I just would like to, especially for myself, management of the child after childbirth was a stress factor for myself because my expectation was overridden immediately, and I feel a feeling of despair and feeling at a loss how my childhood will go out in her development. Um, and for myself, it was a stress factor that was impacting upon my decision making and communication because a stressful brain works differently now. And we are talking about the war, and so it is about the framework of uncertainty, and especially for all those people who find themselves in the cities affected by the active warfare or near the edge of fire. Is absolutely a different understanding of stress. And in this slide, I just would like really to say that deterministic monitoring right now so has its challenges right now because we might have this critical support the because of the and of course, so we talked about it so in our previous talk that so arrangements of the care taking for children is more complicated. In 2020, so we had the project about information awareness campaign for deterministic monitoring. So it is not a new topic for us, but we made a survey among the parents if they know about determinism, their entitlements and access, and 46% of the parents really said that they didn't hear about ketamnasis for their own children at all. And that year, so we collected the data about the ketamnistic units and offices, which we uploaded to our website. And this list is undergoing update. 78% of parents found out the ketamnasis based on our survey that year, that they didn't get it from the neonatologist, but 68% of parents found out about ketamnistic monitoring from the other parents, peer-to-peer. Peer-to-peer, 60% of parents didn't know it was free of charge, and we made a video to raise awareness, so which is deterministic monitoring and who can get hold of it, and so this information reel is uploaded to our website, and we are very glad. So from the YouTube link, so by means of the QR code, you can hit the page, and one of our main streamlines of the early bird association is a psychological and counseling support to our parents here as well. So it's really to provide good management, and this is the Viber platform, and we have Viber-based chat and physical meetings and get-togethers with love. Full of love and online events for 250 families every month. We have now the meetings in the framework of the other projects, but for us, is awareness in the very first round, and remind us that you don't have to waste time. And so going back to the Kateryna centers is key, especially in the psychological, social support for the parents. And one of the projects since last December is the guarantees about free of charge healthcare services delivered that are recourse to the PMG supported by the NHSU. Sometimes the parents are at a loss and don't know to refer to after discharge. So it's really to provide monitoring of the situation, and we made a survey and 300 families with the preterm babies participated throughout an all-round invasion. That means over the last 24 months, and some questions highlighted in the presentation are shocking for us when we ask them if the parents do know when their rights are infringed. 60% said they don't know where to refer to, how to handle it. When we ask the parents, do they know what it is PMG, program of medical guarantees, 74% of parents, respondents have said they don't have this information, and their own knowledge about the packages of the medical guarantees are really highlighted in the 70% of them, so as one. One is the least level of information knowledge, and this is a signal that the communication support when a newly born still cared for in a hospital setting, and upon discharge, there should be information sharing, notification. When Iryna Yuryevna was saying that they should feel responsible, the bonding shall be formed, and the needs of the small one so will be developed. So communication is crucial here. So it's not really to let go of this communication link. Perhaps the informational material shall come in handy to you. That few drafts here as well, and if it is helpful for you, so we'll share these materials in any type of format, both for download and printouts and various charts that we put together in the framework of the project, what explains what is ketamnasis and what is the PMG, and how it is worthwhile and at which time period to do management of the child, so according to which disease areas, and very important elements, how to get hold of these services free of charge, who should give you the referral and this code, and where you should refer to what type of specialist. So we have a page here, so to make it user friendly for you, it says a 1 minute long reel. If you have plasma in your health facility, and you would like, if you have LCD screen in your health facility, so it's got subtitles, credits, and you can really scanning this QR code, was fill out the template, the form, so who are not participants in the project yet. So for keeping your patients informed, ketamnasis is of a crucial importance for ourselves. So some other information products should be created to enhance our informational awareness together with you. Basically, in the framework of this layout and this artwork, we have this baseline information indeed inside our meetings, physical meetings, to reinforce the rights of the patients. So one of the questions, they don't even know what is the package of medical guarantees and how it works it out. We have to explain basic data, and so many patients perceive this hard, this information. That is why it is about a flow charting for them to understand scientific digest, not in medical terminology, to make it more user-friendly for the second year. So with the Polish medical mission, so in the 10 regions by the war, we have this project ongoing, and we inform them about the rights of the patients, and a few events rolled out devoted to communication agenda. And you would like to put a point here sometimes in the credibility establishment, communication between the physician and the patient as this bridge to transfer information So some very important links might be lost, or lack of understanding, or conflicts should emerge. And that is why so credible relationships also require a lot of resources. One of the events, Yulia Alexandrovna, the lecture how to do communication with the parents with the preterm born children, it's in our own website and in the website of our provider. And those QR code is uploaded here if you find it convenient to have another look at it separately, and a few more tips and advice from Yulia to be able to go about this communication arrangements in a more convenient way. And Natalia Tulinova last week event held about crisis communication when the parents are at a loss. So when it is very difficult to find so the common language and communication establishment between the physicians and the patient is our centerpiece of attention. And actually, we put this chunk of information to allow both parties strike an agreement, because in the stress circumstances and the difficult circumstances that our land so survives is pretty painstaking, challenging. The catamnestic monitoring a related project to ensure its incessant performance across the whole board. It's very important to encompass all relevant links to keep in touch with the parents, so upon discharge to get them very clear advice and tips in various formats. So, for instance, printed materials for the parents to go back to, and very clear guidance where to and how. So they should come in for counseling. So after discharge from hospital, and we advise falling into this important work, and we will be very glad to have this interaction to make sure that they should have a brilliant start in their life for every preterm born baby. Thank you very much indeed.
Дякуємо, пані Олександра. Бачу надалі питання до пані Ірини Кондратової, тому перемикаємо вас на пані Ірину. Ще раз вам дякуємо.
Mrs. Iryna, thank you very much for your help and the support in the initiative to make start of this event, and for keeping in touch with the speakers. And but for you, we wouldn't have had access to it. So please get Iryna in.
Чекаємо, поки вмикається пані Ірина.
Let us wait for Iryna to join online. I'm here together with you, so I don't see you yet, but I would like to see you here as well up on the screen.
Я буду шепотіти питання.
So I will be whispering my questions.
І так, до якого
Well,
віку,
until what age? So we've had this already. What is the profession? So pediatric profession or any other pediatric specialization? I don't quite get it. So which specialization of a pediatricians is the best suitable for it? In some European countries, we have a developmental pediatrician, if you like, but it seems to me that you might have heard for Dieter, it might be a psychologist, a medical nurse, occupational therapist, physiotherapist, who've been trained to make use of the toolkits, so by means of which we'll be able to assess the 5 areas of children's development. And I have in here as well, somewhere in the top up, the question whether they secured in the legislation those tools in usage. Yes, they secured it in the legislation. It is not a one-off event. It is a list of the toolkits, and I shared the link with you here, and then we will make it again. So to a certain health ministerial regulation to allow first in many years really to make use of the valid methods for the assessment of the psychological, neurological developments of the newly born. So for the under 1 year old, so for instance, you might want to use something that is free of charge at all for the health facility and for yourself. So to Albert scale, CQ3, so score, and the kit RCDI, Hammersmith, and my beloved Bailey. And so the majority of these are authorized in the framework of those valid methods, and we as a country are not in position to make use of it because we need so the government to purchase the copyrights, and we need the Bailey's bags with the follow-up training to be held. And this is where I would like to reach out to our international partners to get us technical assistance because single-handedly the health facility won't be able to handle it. Let us see. Yana Martinenko is asking the international guideline for internet convulsions from INLE. So in a few more days, it will emerge in Ukrainian to make it implement in Ukraine. Phenobarbital must be authorized level. Phenytoin and Nidazolam injection dosage form must be authorized in Ukraine. And for the third time, I am trying to share a comment. Yes, as a physician and as a representative of the civil service, yes, we do, but the HSU doesn't do this drug authorization. I would like really to bring you back to the health ministry and to the distributors of those medicine products. And Olena Bespalko, you are saying that not a neonatologist, but someone else should submit data about ketamnestic child. Your neonatologist who is working in one of the units of the perinatal center, or let alone of the uh, maternity hospital, is not entitled to enter this data because he won't end up having payment for this. So only the staff working for the ketamnestic unit, anesthesia sharai. So the psychologist must check up the child or interact with the parents, must uh, uh, carry on with the parents, whilst the parents interface with the parents, whilst they are in the wards, and then the psychologist will make part of the multidisciplinary teams that provides a comprehensive care service after the patient gets away from ketamnestic monitoring into rehabilitation. But you might want to bring the psychologist into ketamnestic. I've seen that happen in the perinatal center in Minneapolis, US. So the Bailey-based screening, and they make scoring. Tatiana Holota, do you think that there should be vaccination? So according to the immunization schedule and advised in the ketamnestic wards, it must be mandatory, as let alone in the neonatal ward, because this vaccination based on the actual age, not on the post-conceptual age, for that matter, civilized world, as the children from the RS already vaccinated in the Konatska perinatal center when the child during when the child is being cared for. So we have different practice in place, but we are trying to strive for a new, better world in the future. So upon discharge from perinatal center or from the children's regional hospital, or when visiting the ketamnestic ward. So data has been showing to you so far as children's follow-up is concerned. So the specialists advise vaccination because, you know, if you track down your children, so all of them, the children's neurologist, so put it off vaccination for years to come. This is a disaster in Ukraine. Nina Kova. So that means management in the ketamnestic unit is package 9 of the outpatient with the counseling. 56 hryvnia worth is the basic rate. 56 hryvnia worth. I'm not ready to say. So 56 hryvnia it was last year, and now we have a different coefficient applicable. That is why we'll have to have another look what it takes for the next year, that you would like to change something in this respect, let alone here now and with the heads of the NHSU. So at the very beginning, we had a conversation. So forget about 56 Grinchenko UM. Please let us know what is the format of the Keteministic ward performance report and how often it should be compiled and shared. I don't have this. So the NHSU doesn't accept any paper-based, so we just have electronic records by means of your medical information systems that you submit, and they get through to the central database. So we don't have paper-based reports in the NHSU. Mrs. Marie is asking, do you have the only register of the Keteministic children? You said that Ketemnes is MIAS based. What is the right way to include it in the system? Please look here. Those technicalities, can you really pull them off together and dedicate it in a separate seminar? Because I don't know. So the answers to all of these questions, honestly speaking, you have to find out what type of medical information system installed in your health facility, and some really should be followed up on, because if you pay attention, it is the very first time that you referred about ketamnestic monitoring in a live setting and the paper-based documents, and it looks pretty much the same as in the e-health. We should really bring it all together, and perhaps Kateryna will lend us a helping hand, and we'll have a technical webinar devoted to the agenda. Tatiana Orlova in the legislation of Ukraine, so we don't have a clinical guidance about ketamnesis. So what is the forthcoming perspective? We go back to 10 o'clock up in the morning, we don't have it. And the most immediate one, we have the Cabinet of Ministers regulation, we have the Health Ministerial regulation here as well. That is about a legal opportunity to make use of the valid methods and toolkits for the assessment of the young, early age children. Ketamnistic monitoring procedure is now underway in the Cabinet of Ministers of Vladislava Volkova. Upon discharge, so children's rehabilitation is paid at the expense of the medical guarantees or out-of-pocket payments. So upon discharge, and when really putting them into ketamnistic monitoring or to the GP setting, so the GP setting or the attending physician who might be the physician from ketamnistic ward or neonatologist from whom you discharge from the maternity hospital, you must ensure that these physicians must make an electronic referral for the rehabilitation package of preterm born babies until the age of 3. So the NHSU is a purchaser of this service from the health facilities, while the contractual package holders, and there are the specifications applicable for the team who provides this rehabilitation, and likewise requirements applicable for the equipment, and you might want to reach out to the health facility contracted to deliver this type of service. It might be in an outpatient setting or inpatient setting delivered to combined setting, when for several days the child is admitted into hospital on the ward with the mother, and then for a comprehensive checkup, and then we'll carry on with the rehabilitation program in accordance with their individual rehabilitation plan in outpatient setting. And the service is being procured that is lasting for 21 days, or so in any type of option, so 3 times per week, 2 times per week, and it takes the NHSU, it seems to me, 10,800 for these 21 days is paying to the health facilities. How many episodes of this comprehensive 21 day long periods? So as many times you might want to refer to the attending physician to get hold of this service if catamnesis is follow-up of the package 8, till what age? Pediatrician, neonatologist. So, Katya, but I didn't hear you well. So, about neonatologist, catamnesis is not follow-up of the package 8. Catamnestic monitoring is provided in the framework of the outpatient package, but it goes without saying, since we are talking about the newly borns, so who were cared for in the perinatal center, let us talk about an ideal scenario. Perinatal center, the third level, or municipal general purpose hospitals. So they were cared for in that facility, and they go back to this facility for catamnestic monitoring. If you attentively listen to details, he says you don't have to involve neonatologists for the assessment of children's development because they had a survey when the neonatologists included, so they underscored accordingly just because they had the pressure of the knowledge that they knew about these children and something that that child survives. And either it takes a GP or pediatrician or a well-trained nurse or psychologist or a physical therapist who should provide a gymnastic service. So we're not talking about neonatology. So for us, reason, it was our reckonings that in this ward, in this unit, it should be neonatologists working here. So, but it shouldn't be a practice like this. Larissa just saying, so as of now, gymnastic board-based service delivery is formulated not in relation to the NHSU requirements, but to cater to the requirements of a certain facility. No, the size of services is put together in relation to the outpatient package with the appropriate a list of medical services and requirements applicable for the staff and the equipment alike. If you're talking about to say that we don't have regulations and the bylaws that secure the provisions of the care service delivery in the nation, we don't have it, but we purchase the service in relation to the packages drafted by the NHSU for that matter. But this outpatient catamnestic monitoring related service must be available in a healthcare service facility that has a package of severe neonatal cases and that provides care to the children and discharges them from and then puts them into a catamnestic monitoring. If a if a baby in a maternity hospital upon childbirth for 14 days and then refers to hospital, so and spends 1 month and gets access to highly expensive services, but only it is the maternity hospital that gets payment for the catamnestic service delivery from the NHSU. So you have a distorted information. So it doesn't happen like that, first of all. And secondly, the NHSU right now is doing their utmost and will carry on doing so again, so as to ensure that the health facilities that are well contracted, the package 8, be a neonatal case. So they have in accordance with the agreement, they have a mandate to care for the children, and unless they have surgical pathology, they will refer those children, and these health facilities either will be stripped of this package for later on, or they will end up having payment given to them. So down dwindling coefficient for the case, for that case will be accounted for in the framework of one treated case. But the facility that is meeting this child upon referral in let alone a surgical pathology with a complicated healthcare service delivered, then this health facility that provides this service, so pursuant to this package, upon the highest rating in the nation, if it is neonatal surgical intervention and appropriate payment from the NHSU, please refer back to the provision about the medical guarantees, what it looks. Iryna Chmielewski is asking. whether the catamnestic unit may be attached to the rehabilitation health facility. Theoretically, I think yes, but the philosophy here is different. And whenever we have the final draft of the regulation out for public hearing, you will be able to participate in its discussion rounds. Daya Kostikova is asking, why do the physicians have to refer to the drug registry and distributors for the authorization of the anti-convulsive drugs? They don't have to refer anywhere. If they don't want progress here, they must refer to the health service policy making body, i.e. the health ministry. Grabowska Iryna, if the catamnestic unit ward is doing monitoring over preterm born and sick baby and do rehabilitation between 0 and 3 and have appropriate specialists on the staff, is it the best case scenario? You're flattering me if you understand, if you that I understand which is the best suitable one, but I do know that perinatal centers of this standing in the regions that concentrate all the preterm deliveries up to 32 weeks of gestation, they must be equipped with catamnestic units and appropriate staff, and they are entitled, they are in position to perform, to run so control, so checkups, audiometric and ophthalmic scan for the children. They for sure have the pediatrician must have who is very knowledgeable about vaccination, and in the ideal case scenario, they might have this rehabilitation service. It might be an inpatient setting or mixed bag or just outpatient. So for the preterm babies or the perinatal pathology. So an ideal case scenario is this, and I've seen this happen, by the way, in the regional perinatal center in Lviv, and they have early intervention service there as well. That is, and likewise, it proved efficient in the regional perinatal center of the regional hospital in Kharkiv, and until it was in existence, and it made a very convincing impression. And this service is well arranged in the perinatal center in Kiev. If you're interested, if you refer to these health facilities, the colleagues will be glad to show you how it works. If more questions popping up, so far we don't have any questions, and I can see here. Thanks for Oleksandra for her presentation, and Oleksandra Balyasna from the TV viewers, and as I can see, we can call a day to this event. Thank you. So the closing remarks, all yours, Mrs. Iryna. Thanks very much indeed to UNICEF. Thanks very much to Oleksandra. So, but for your assistance and support and involvement in this process, so it could have been short-lived. And hopefully it is just the inception, and hopefully that more technical meetings shall be held. So following through on all those agenda items that the colleagues have asked, and I would like to say that you don't have to reinvent the wheel once again, because it is well functional in the neighboring European countries, and you might want to take this combined model to implement it in the Ukrainian setting. As I understand, you have counterparts in France, so it is very much painstaking during the all-out war and the everyday shelling. But please bear in mind that the children is our future here with, and I'm sure that those children who are being born in this country, especially the children that will later on rebuild Ukraine afterwards, let us allow our own time. So it's really to give our dads to the preterm born babies in Ukraine. Thank you. Thank you, colleagues. You will get it in the distribution list with the video recordings of these presentations that you've seen this today. Thank you very much indeed that you've been viewing this event, and those of you who had a holiday, a day off, but so thanks very much for this high attention. So given to this topic, thank you very much. Enjoy your day.